Comprehensive, relevant, and insightful conversations about health and medicine happen here at MedStar Health Doc Talk. Today, we're discussing a new transplant partnership between MedStar Georgetown University Hospital and the Washington, D.C. Veterans Affairs Medical Center that benefits military veterans across the country. We're talking today with Dr. Rohit Satoskar, Director of Medical Services for the MedStar Georgetown Transplant Institute, and a special guest, Dr. Atusa Rabi, Chief of Transplant Services at the D.C. VA Medical Center. Dr. Rabi, Dr. Satoskar, welcome to Doc Talk.
Thank you for having me.
Thank you so much for having us.
So we're here to talk about the Veterans Health Administration adding MedStar Georgetown University Hospital to its national solid organ transplant network. So first to start, Dr. Rabi, can you give us some background on exactly what that means for the VA Medical Center and your patients?
Yeah, absolutely. So there are VA transplant centers across the nation that are open to veterans to get evaluated and transplanted for solid organs. To give you a little bit of background, we would be the fifth in the nation that are approved for both liver and kidney transplantation. The importance of this is that previously, through using our community care services over the last 5 years or so, we have developed a relationship with MedStar Transplant Institute, and we have been sending our patients through that route to Georgetown. However, adding us as a VA transplant center means that not only patients in the DMV area, but any other patient across the nation, as long as they're a veteran and they have VA benefits, can potentially get evaluated and listed and transplanted at Georgetown. So this would definitely increase access to veterans in the DMV area, but far beyond that.
So we're going to dive into in just a second exactly what this means for these patients specifically. But first, Dr. Satoskar, what is this change and how does this benefit us at the Transplant Institute at MedStar Georgetown?
Mm-hmm. So as Dr. Rabi mentioned, this was sort of a natural expansion of a partnership that began many years ago. So when I've had the pleasure of working with Dr. Rabi, I think since she arrived at the DCVA, and we have collaborated on patient care, on liver transplantation, bringing liver transplant to veterans who are in need of the life-saving procedure. And that sort of continued partnership is now going to a different level. And so, rather than sort of answering the question of what it means really for us in the Transplant Institute, I think the bigger question is what it means for patients. So, to quickly answer the first question, for us, we have the capacity to do this. We, of course, have a very strong interest in doing this. We are on the verge of moving into a new hospital pavilion, which will bring state-of-the-art technology in the ORs, as well as private patient care rooms that the veterans would enjoy when they're here. But this partnership really is going to expand the reach for veterans in terms of access to this life-saving procedure. So I think that's really the great benefit of this partnership.
Dr. Rabi, you said there's a couple of different organizations now you've worked with, and this is something that's a priority for the VA Medical Center. So what is the benefit now to the patients you're seeing that are in need of these transplants moving forward, that they have more access?
Correct. So I think even before we had this partnership approved by National Surgery Office as a VA transplant center, our closest transplant center were Richmond and Pittsburgh, which obviously made it very difficult in case of patients who were very sick, were admitted in the hospital, and were in urgent need of transplant. So we basically developed this very close relationship, which, according to my own patients, they never felt like they were being treated in two different institutions. So while we sort of iron out all the details of our partnership, we then approached National Surgery Office to give us this opportunity to be basically placed on the map as an approved VA transplant center. And I think, as Dr. Satoskar mentioned, the part that we were able to demonstrate that there is a very close partnership. We have the details of this partnership already sorted out, and we basically rely on our partner whenever there is a lack of specific services at the VA, but also we have this sort of trust between us that we are able to improve our services at the VA. We got this approval. And again, other than providing services to the patient who are in the DMV area, we have now already over the past couple of months, we have been able to evaluate patients from Virginia, from Connecticut, and we just hope that this will continue to grow.
So we know the idea here is linear, more inclusive care in this partnership. So let's dive into exactly what this might look like for a patient who's coming into this. So this is going to help veterans specifically who are suffering end-stage liver disease, kidney failure resulting from conditions for which transplant is the only available option when we talk about long-term survival. So Dr. Satoskar, let's start with you. What is this going to look like for patients moving forward who are in need of these transplants now that this door has been opened?
So for patients who are in need of some of these transplant procedures, they may come to Dr. Robbie's team from VAs across the country. So they may be within sort of our VA region or what's called a VISN, or beyond that. So they may come from VAs that are more local to their community, for example, in Baltimore or in Winchester, or they might come from farther out. So they would be identified initially by their local physicians as needing a liver or kidney transplant. And then the VA has an internal system by which that referral would be placed. And then Dr. Robbie's team would sort of take it from there. And maybe I'll turn it over to her to talk a little bit about what happens after that. But their team would pick up that referral and then begin the process and then bring us in.
Correct. So any physician within the VA system can make this referral. Usually for end-stage liver disease patients, they come from a gastroenterologist or a hepatologist who has been taking care of them. For kidney patients, sometimes these are patients who have been on dialysis, so kind of can self-identify and ask their physicians to place this referral. As Dr. Satoskar mentioned, there is an internal referral process. So these patients basically are placed in a system that then the VA transplant center that they're assigned to gets an alert depending on how urgent it is. They're usually seen at least via video visit, which is a very common platform that is being used at the VA within 2 weeks to determine first and foremost if medically they're eligible. From then, if they're medically eligible, they're then brought to the VA. And one of the important things about this partnership is that we are able at the VA to help veterans and their support person with their travel expenses, with their lodging, which there is lodging accommodation at the VA called Fisher House that they can stay with their support person. And then this would provide them with an in-person visit so they can meet the whole team. We are able now to do almost all of the evaluation at the VA, including social work, mental health provider, and some of these tests are actually done at the local VA. Once this sort of evaluation is completed, then we have a joint committee that we discuss medically, socially, and sort of all aspects of that are involved in the transplant process, and then patients are listed. Again, when they go back to their local VA, there is an arrangement by their local VA that we walk them through it, that they would be able to use travel and lodging when they are called for an organ so that they can travel to DC.
So we know that there's a lot involved in a transplant. It's not just the transplant procedure itself. It's, Dr. Rabi, like you talked about, expenses for travel, the list to get a donation, preoperative, postoperative care, recovery, and follow-up. Dr. Satoskar, how might we at the Transplant Institute work with the VA Medical Center on all these steps, not just getting a patient, but working with them on follow-up, on the care of the patient, on all these things? How does that benefit doctors at the Transplant Institute?
Yeah. One of the things we've been fortunate with is that, again, this long-standing relationship has allowed us to iron out some of those details, even prior to going live. So we really aim to have a seamless process for patients. And part of that is based on having seamless communication between our teams. So Dr. Robbie has really assembled, I think, a world-class team at the VA, to be honest with you, which includes, not only the physician expertise that's there, but in addition, the other staff that goes into supporting patients who go through the liver transplant process. So as you alluded to in your question, and I shouldn't just say liver transplant because it's for both liver and kidney, but patients who undergo organ transplantation get support by their centers in various ways. And it's not only medical support, but there is support from nurse coordinators, from dietitians, from social workers, and from many other parts of the staff to make sure that the patient really has a successful experience. That exists both at the VA and at the MedStar Georgetown Transplant Institute. And we really work collaboratively to make sure that happens for the patient. So that begins at the VA. But then throughout that process, there is back and forth communication up until the time the patient is discussed for listing at our listing meeting. And then once they're placed on the list, that communication really continues until they're transplanted. The transplant procedures will occur at MedStar Georgetown University Hospital. And the immediate postoperative care will also occur at the hospital here. Once patients are discharged from the hospital, they will have some initial visits with the team at the MedStar Georgetown Transplant Institute. But once stable, we'll return their care to the VA, where they will go back seamlessly again to Dr. Robbie's team. But we are always available even after that point, if need be. As a liver transplant physician, I'm going to focus a little bit on liver. We have seen increases in terms of the incidence of liver disease in general over the past several years. And there's multiple things that are driving that. We've seen a continued increase in what is called alcoholic fatty liver disease. This is fat deposition in the liver that is a result of factors that do not involve alcohol. So many patients have risk factors such as diabetes or obesity or metabolic syndrome. Recent estimates suggest that up to 30% of the U.S. population may have this disorder. Now, of course, not all of those patients will develop advanced liver disease or need transplant. But when you're talking about 30% of the U.S. population, that's a lot of people. So that's one driver. So we're seeing now a rise in need for liver transplant for this indication. And it's one of the top indications now for liver transplant. Another indication for liver transplant is alcohol-related liver disease. And we have seen an increase in incidence of alcohol-related liver disease during the pandemic for various reasons, as you can imagine. So that is another driver of need for transplant. But then beyond that, there are many other causes of end-stage liver disease. There are genetic causes, there are viral causes, drug-induced liver injury, sometimes we see, and there are other conditions that affect children, which we're not here specifically to talk about that today. But those are some of the reasons why someone may need a liver transplant and some of the things that are kind of driving the increase in that need.
So MedStar Georgetown University Hospital and the DC VA Medical Center are both based and centered in the DC area. However, this new partnership is not just going to benefit veterans in need of transplants in the DC area. Dr. Raby, can you talk a bit about how this might benefit patients in other parts of the country, what that might look like for somebody who's going to come here for their care, even if they don't live here?
Correct. So although there might be situations that there would be a transplant center, a VA transplant center that is closer to a veteran, but there are some unique features here that we can point out. One is the fact that we are able to offer both liver and kidney simultaneous transplant, which is more and more becomes a problem, as Dr. Satoskar mentioned, with the increase in the number of those patients who with a lot of risk factors with metabolic syndrome get transplanted. The other important thing to mention is that Georgetown is able to offer living donation for liver transplant, as well as including the kidney transplant candidates in NKR, which is National Kidney Registry. So both of these options are available to veterans as well. If veteran identifies someone as a donor who is not a veteran, they can still register at the VA and their costs can be covered by the VA. And those are very unique features for which somebody might decide to actually travel. That is, aside from obviously looking at outcomes, that was one of the main reasons that we actually chose and demonstrated that to National Surgery Office to pick this partnership, which is excellent with MedStar Georgetown.
So moving forward, what stands out to you most about this new partnership?
So for us, this is really an incredible opportunity. It's a unique opportunity. And it's truly an honor for us to be able to care for the nation's veterans in the nation's capital. I think that there's something very nice and symbolic about that. But being able to partner with the VA and bring these life-saving procedures to veterans is very important to us. I'm just very honored to be included.
We are extremely excited about this. I think this is one of those important steps that National Surgery Office has made to increase access, but specifically, as Dr. Satoskar mentioned, in the capital. And we look forward to expanding the access not only on liver and kidney, but to other organs, and continue our partnership.
Thank you so much for taking the time to be with us today, Dr. Satoskar and Dr. Raby. We hope you've enjoyed learning about this new partnership between MedStar Georgetown University Hospital and the Washington, D.C. Veterans Affairs Medical Center, which benefits military veterans across the country who are in need of liver or kidney transplants. We've been talking with Dr. Atusa Raby of the DC VA Medical Center and Dr. Rohit Satoskar with MedStar Georgetown University Hospital in Washington, D.C. For more information on this new partnership and what it means for veterans, visit medstarhealth.org/services/medstar-georgetown-transplant-institute or call 202-444-3700.